Hey guys, this is Naya. I'm back and to answer more pharmacology questions that can come to our exams. So the question I'm answering today in this video is giving example, classify anti-platelet drugs. So what are anti-platelet drugs? These are drugs that are used to prevent platelet aggregation or the clumping together of platelets to form a clot. This is by inhibiting certain pathways that are involved in the aggregation or inhibiting some of the platelet aggregators in our bodies. So pathways like COX, which produce thromboxane, which is a platelet aggregator, have to be inhibited. Some other pathways, such as in that pathway of protein phosphorylation, we have to have like phosphodiesterase inhibitors to avail CAMP. And when we have CAMP, that is cyclic adenosine monophosphate, you're going to prevent platelet activation. We also have ADP, that is adenosine monophosphate. We have to, it's a very potent platelet aggregator, so you have also to inhibit it. We also have, yeah, I think that's all the platelet aggregator that we have. So by inhibiting certain pathways or platelet aggregator that are produced, yeah, we are able to prevent platelet aggregation. So let's classify these antiplatelet drugs. So I think we have 5 classification, yeah. So let's start with the first. The first one is COX inhibitors. When I say COX, that is cyclooxygenase inhibitors. We have an example of a drug that is aspirin. Aspirin kama kiungo. Umesikia dawa aspirin or acetylsalicylic acid. So and I've said so COX, they inhibit formation of that pathway inhibit the formation of thromboxane, which is a very potent aggregator. So that is the first classification, COX inhibitors. Example of the drug, aspirin. The second classification is adenosine monophosphate or receptor antagonist that involve formation of ADP. ADP is a very potent aggregator, so you have to inhibit it. So you have those drugs that inhibit the ADP receptor. We have the drug is prasugrel, yeah, clopidogrel, and also ticagrelor. I don't know how to pronounce that well, but the main drugs are prasugrel and clopidogrel. The third classification is the what we call the thromboxane receptor antagonist. There's one drug that is terutroban. And you have the fourth classification is the phosphodiesterase inhibitors. And we said if you inhibit phosphodiesterase, you're going to avail CAMP, and CAMP prevent platelet activation. Example of a drug is dipridamol and silostazole. Yeah. Then you have the last class, we call them monoclonal antibodies or glycoprotein inhibitors. We have glycoprotein E2A, E2A and 3, 2B and 3A inhibitors. So those drugs, they're used in acute settings. So we have example of the drugs is abciximab and tirofiban. You have also many other examples, but just know those examples. So we have, as I summarize, we have 5 classification of antiplatelet drug. COX inhibitors, aspirin. ADP receptor antagonist, we have prasugrel, clopidogrel. We have glycoprotein inhibitors, we have abciximab, tirofiban. Then we have the fourth, then we have the thromboxane receptor antagonist, you have tirotroban. The fifth, we have phosphodiesterase inhibitors. Example of the drug is dipridamol and silostazole. That's all I wanted to share about antiplatelet. Till next video, tuonane. Yeah.